Welcome friends, Mike Collins here, again another one of our prescriber spotlights. I'm from Healthway Compounding Pharmacy and very fortunate to have with us today Dr. Olivia Phifer-Combs.
Hello.
Welcome.
Hi. Thank you.
Thanks
so
for
much
being
for
on
having
again.
me.
Now today we thought we would dive into one of our topics that we discussed in one of our previous segments, and we're going to talk about menopause. You ever notice that all of the problems that women have begin with men? Menopause, things like that. Oh, whatever. It's just a little joke. All right. So, doctor, tell us a little bit about what is menopause?
So, usually menopause average age is around 51, 52, and really it's when basically a woman goes 1 year without any bleeding. That's actually the definition of a woman in menopause, but actually not all women still have their uteruses to tell us that year without bleeding. And therefore, it's the start of basically your hormones starting to change, which will cause pretty severe symptoms, such as hot flushes, night sweats for those women that are unable to have that classic definition of 1 year without bleeding. And that's usually, like I said, around the average age of 51, 52.
Cool. So tell me, why would your patient come and see you? They think they're having some of these symptoms, but what are some of the symptoms that would really drive them into your office?
I would say the most common things we see patients for are especially women experiencing severe hot flushes, night sweats, especially at night, that over time start to become a burden of their everyday life. You're up all night, not able to sleep, so then you get fatigue, irritability, and that really can affect a woman's everyday life. And then I would say the next most common thing is something called vaginal vulvar atrophy, which is basically a big component of painful intercourse, to where just the structure of the woman's body starts to change.
Sure. So do old people really have intercourse? How old are some of these ladies?
They do. I'd say some in the 70s, 80s, they are still going at it.
Excellent, excellent. Well, that's great. So let's talk about some of the things that you might use to treat these patients with. Mm-hmm. Now, I'm a compounding pharmacy, and there's times when yourself and many other physicians will write certain prescriptions to send to us. Mm-hmm. Let's talk about some of the things that you might be able to help your patients with. First of all, hot flashes, I guess. What kind of things do you think about helping patients with hot flashes?
So usually with hot flushes, night sweats, those type of symptoms is some type of transdermal type estrogen. So an approach of estrogen through the skin, not necessarily a tablet. That is a method, but our national guidelines actually say a transdermal type of approach, whether it's a spray, a cream, a patch is something else. There are many forms, a way to give women that estrogen replacement.
Perfect. And so when we talk about vulvar issues and vulvar pain, are we still talking about estrogen again in a topical form, or what other types of things would we use for that?
Usually, yes, still a topical form, but it's more of a vaginal approach. I would say the most common would be our creams. Now, I know we can prescribe in various forms, whether it's prescribing to an actual pharmacy, but that always isn't the best approach for some women, and so therefore we'll also prescribe to you so that you're able to try to tailor that for women. And what kind of products is it that you
So from a compounding pharmacy perspective, a lot of times what we're doing, and we're custom making medicines. In other words, we work with your prescriber to come up with the best solution for you. And many times the commercial products are just too expensive. So whether it's a high copay or whether it's a product that's just too expensive for them to afford, which we're all about getting patients to use what you prescribe, correct? I mean, it doesn't do a lot of good for them to spend all that time in your office, you to find out what their problem is, and them never get the prescription filled.
Correct.
That's a common problem in pharmacy, that people are not compliant. That's the word that we use, is compliance. We want you to be able to take your medicine. And if you can't afford it, then obviously that's a major hurdle to prevent you from being able to get your medicines. So as a compounding pharmacy, I have the ability to be able to, now I can't copy a commercially available product, so I'm not making the exact same thing that you might get at a Walgreens, for example. But I can work with your physician to come up with things that are very similar that might work just as well as what that commercial available product is. And estrogen creams are a good example of something that typically is kind of expensive, and some patients just can't afford it, so they'll come to me to look for a different solution. But everything I do is on prescription, so you just can't walk into Healthway Compounding Pharmacy and say, hey, I need a cream. I can't make that without information from your doctor. So let's talk about some of the other issues that kind of go along with menopause. So we talk about hot flashes, vaginal dryness. Back to hot flashes, I think sometimes people think that only estrogen is an option for that, but there are some people that either don't want to or don't take estrogen. Do you have other solutions for them that don't want to use estrogens for hot flashes?
Yes, because with hormone replacement therapy, we have to obviously go through a patient's risk factors and everything to make sure it is something that's safe for them. And if hormone replacement therapy isn't, there are other options that we can help that are even FDA approved. There are certain antidepressants that some women will use. I have many women that are unfortunately, due to some issues like breast cancer or history of stroke, cannot take the estrogen, and so therefore there are other routes still. Also lifestyle type changes. I have a handout that I'll give my patients of kind of everyday, like I said, lifestyle changes that can help with those symptoms as well. So it's not necessarily always about this one way, but it is our gold standard if a patient, meets the criteria to be able to healthily take that.
Very good. Awesome. So now a patient realizes that they may be entering menopause. Maybe they've never been to an OB/GYN in many years. How do they see you? Do they need a referral to come and see you? Do they have to have their family doctor write a letter to come see you? Can they just call and make an appointment? How do they get to see you?
Usually you can call just to make an appointment with our office. Some insurances actually require a referral, so that's out of our control, but at the end of the day, any patient could call at any time to see any of us here at Valley OB, and we're more than happy to. All of us love what we do, and so
excellent.
Yep.
Well, I'm so pleased to have you again with us today on our Prescriber Spotlight.
Thank
Mike
you.
Collins from Healthway Compounding Pharmacy and Dr. Olivia Phifer-Combs. Thank you.
Thank you.